This is Dr. Reshmi. In this video, we are going to see about diagnosis of pregnancy. Duration of pregnancy is 40 weeks or 280 days or 9 months and 7 days. The period of gestation is calculated from the first day of last menstrual period. Trimesters. First trimester is from the time of confirmation of pregnancy to 12 weeks. Second trimester from 13 to 28 weeks and third trimester from 29 to 40 weeks. First trimester symptoms. The patient usually gives history of missed period, morning sickness like nausea and vomiting, increased frequency of micturition, breast enlargement, heaviness, discomfort and pricking sensation, increased food cravings and fatigue. Breast signs are increase in vascularity and size, dilated visible veins, increased pigmentation of the nipple and primary areola, appearance of secondary areola, Montgomery tubercles appear, which means dilated sebaceous glands, expression of colostrum as early as 12 weeks. Abdomen. Uterus remains a pelvic organ until 12th week. It may be just felt per abdomen as a suprapubic bulge. Pelvic signs. Jacquemus sign. It is also called as Chadwick sign. There will be dusky hue of the vestibule and the anterior vaginal wall at 8 weeks. It is due to local vascular congestion. Osiander sign. There will be increased pulsation felt through the lateral fornices at 8 weeks. Goodell's sign. Cervix becomes soft as early as 6 weeks. Softening is more around the external os and also in the upper part. Pregnant cervix feels like a lip of the mouth. On speculum examination, there will be bluish discoloration of the cervix, which is due to increased vascularity. Uterine signs. On per vaginal examination, the size of the uterus is enlarged, soft in consistency and globular in shape. Hagar's sign is usually elicited around 6 to 10 weeks of gestation. It is done by bimanual pelvic examination. 2 fingers are introduced into the vaginum into the anterior fornix. Other hand is kept over the abdomen behind the uterus. The fingers of both hands can be approximated as the lower part of the uterine body is soft and empty. Palmer's sign. There will be uterine contractions on bimanual examination. Test beta HCG. It is detected in mother's blood and urine. In blood, it is usually seen after 8 to 10 days of conception and in urine around 24 days of conception. Ultrasound. Dating scan is usually done in first trimester. In this, gestational sac and yolk sac is seen around 5 weeks and fetal pole and cardiac activity around 6 weeks. Second trimester symptoms. Amenorrhea persists. Morning sickness and urinary symptoms gradually decrease. There will be quickening, which means the patient is usually able to perceive fetal movements. In primi, it is around 18 to 20 weeks and in multi around 16 to 18 weeks. There will be enlargement of abdomen. Abdominal examination. On inspection, linea nigra. It is also called as pregnancy line. It is a linear hyperpigmented line that extends vertically from the pubic symphysis to xiphisternum. Striae gravidum, which means stretch marks during pregnancy. Palpation. The fundal height increases. Uterus is abdominally ovoid. Braxton Hicks contraction occurs, which means intermittent painless contractions. Active fetal movements. External ballotment can be elicited at 20 weeks and palpation of fetal parts and fetal movements by the obstetrician at 20 weeks. Auscultation. Auscultation of the fetal heart sound as early as 20 to 24 weeks by stethoscope and uterine souffle, which means soft blowing and systolic murmur heard at the sides of the uterus. Investigations. Ultrasonography. In second trimester, anomaly scan should be done. Fetal anatomy, placental localization, integrity of cervical canal and fetal heart rate should be done. Third trimester symptoms. amenorrhea persists, there will be enlargement of abdomen which leads to dyspnea. Lightening usually occurs at 38 weeks. There will be a sense of relief of pressure symptoms due to engagement of the presenting part. Frequency of micturition reappears and fetal movements are more. Signs: cutaneous changes are more prominent with increased pigmentation and striae. The shape of the uterus is spherical. The fundal height comes down to 32 weeks due to engagement of the presenting part. Braxton Hicks contractions are more evident. Fetal parts and movements are easily felt. Fetal heart sounds are heard distinctly. Investigations: fetal growth assessment is done by growth scan, AFI, placenta, estimated fetal weight, and fetal biometry should be seen. Differential diagnosis: fibroid uterus, distended urinary bladder, cystic ovarian tumor, encysted tubercular peritonitis, hematometra, and pseudocysts. Things to do after confirming pregnancy: make a doctor's appointment, be patient with the big announcement, start taking folic acid, quit smoking and drinking alcohol, exercise daily, eat healthy, and stay hydrated. Thank you. Please like, share, and subscribe if you like this video.